Okay, so you know how we all get bombarded with like a million things every day, right?
Yeah, definitely.
Especially in home health.
Especially in home health.
Like it never ends, right?
Yeah.
And we're always trying to sift through it all and figure out, what's actually important.
Right. What do we need to pay attention to?
What's going to actually make a difference in our agencies.
Yeah.
So that's kind of what this whole deep dive thing is about.
Exactly.
It's like, let's grab all that crazy information out there and boil it down.
To the good stuff.
Yeah, to the stuff that actually helps us, be better leaders and run things smoother.
Yeah, absolutely. And I think this is especially important, for the folks out there who are actually in the trenches running these home health agencies.
Yeah, the owners and managers, the ones who are dealing with everything from like crazy census swings to making sure their teams are happy and, actually providing amazing care to their communities.
Right, because it's not just about the numbers, it's about people too.
Exactly.
And that's a whole other layer of complexity.
Oh, yeah, for sure.
So today we're taking a deep dive into something that I think every home health leader struggles with.
Oh, yeah. I know what you're going to say.
The daily habits of successful home care CEOs.
Yeah, because let's be real.
Yeah.
Some of these folks seem like they have superpowers or something.
Right.
How do they do it all?
Yeah. So to get some insight into this, we've been looking at a podcast with Michael M.
Oh, yeah. He's great.
Yeah, he's like a veteran in the home health world, right?
Over 20 years of experience.
Yeah, he's seen it all.
So we're going to try to extract some of that wisdom from him.
Yeah, pull out those golden nuggets.
Yeah, and figure out what these successful leaders actually do on a daily basis.
Yeah, practical stuff that you can actually implement tomorrow.
No theory, just, real world stuff.
Exactly, actionable insights.
So first up, time management.
The ever-present struggle.
Yeah, because seriously, in home health, your time is like more valuable than...
It's the most precious resource.
More valuable than like the winning lottery ticket or something. You're pulled in so many directions, it's insane.
Before you even finish your first cup of coffee.
Exactly.
And what Michael M. really emphasizes is that it's not just about being busy all the time.
Right.
It's about being productive.
So it's not just like running around like a chicken with your head cut off.
Exactly.
It's about like actually focusing on the things that are going to move the needle for your agency.
Yeah, the things that are going to make a real difference.
And it's so easy to get caught up in the urgent stuff.
Yeah.
But not necessarily the important stuff.
Oh, yeah, all those little fires that pop up.
Right. And sometimes you got to just let those fires burn for a minute.
You got to prioritize.
Yeah.
And one of the most important things you can prioritize is your people.
Your team.
Yeah. M actually quoted April Anthony. She was the CEO of Encompass Home Health and Hospice.
Oh, yeah. I've heard of her.
And she said, "It's important to make sure that you are putting people first. I believe if we care for our people, they will care for us."
And that's so true, right?
It's like the foundation of everything.
If you don't have a happy and supported team, then nothing else really matters.
You're not going to get very far.
Exactly.
And it's interesting because Paul Cusserow, the CEO of a big home health franchise, he echoed that sentiment.
Really?
Yeah. He said that his company is just a company of people, nothing more than people.
That's pretty profound when you think about it.
It is. It really brings home the human element of home health.
Yeah, and it makes me think of that saying, if you want to go fast, go it alone. But if you want to go far, go with others.
Oh, yeah, that's a good one.
So as leaders, we need to carve out time to actually connect with our teams.
Yeah.
Like really connect them, the nurses, the aides, the office staff.
Have those conversations, those check-ins.
Yeah, because that's not just some feel-good, fluffy stuff.
Right.
That's how you build a strong foundation for your agency.
It's an investment.
It is.
In the long-term success of your business.
Okay, so we talked about time management. Now let's talk about communication.
Oh, yeah, another big one.
Because in home health, you are constantly communicating.
Right? It never stops.
Emails, phone calls, voicemails, text messages.
It can be overwhelming.
It's like a never-ending cycle.
Yeah.
But what Michael M. stresses is that it's not just about the quantity of communication. It's about the quality.
Exactly. It's about being intentional with your communication.
So like cutting through the noise.
Yeah, focusing on the things that really need immediate attention.
Or things that are going to impact someone else's ability to do their job.
Yeah.
And M actually shared a really cool example of this from Steve Rogers. He's the CEO of a pretty big home care franchise.
Oh, yeah, I think I've heard of him.
And Rogers basically put their communication on steroids.
On steroids? What do you mean?
Like he really ramped it up.
Oh, okay.
So he started sending a daily text message.
Every day.
6 days a week.
Wow.
to all of his caregivers.
And what did he say in these messages?
Just like important updates, reminders, things like that.
Okay.
And then on top of that, he would send a weekly video message.
A video message?
Yeah.
To who?
To the entire team.
Wow. So he's really putting himself out there.
He is. And, it doesn't have to be anything fancy.
Right.
And pointed out that most of us have smartphones.
Yeah.
We can easily record a quick video and send it out.
No need for a Hollywood production.
Exactly. Okay. It's just about making that effort to connect.
And I think that's really key.
Because when you communicate effectively, you boost morale.
Absolutely.
When your team feels like they're in the loop.
Yeah.
And they understand what's going on.
They feel valued.
Yeah, they feel connected to the agency's mission.
And that can make a huge difference in things like nurse retention, caregiver recruitment, and preventing burnout.
Oh, yeah, for sure.
So it's not just about sharing information.
Right.
It's about building relationships and creating a sense of community.
Okay, so we've covered time management, communication.
What's next?
Now let's talk about staying informed.
Oh, yeah. You got to keep up with what's happening in the industry.
Because the home health world is constantly changing, right?
Always evolving.
New regulations, new technologies, new challenges.
So trying to hit a moving target.
Exactly. And as a leader, you can't afford to fall behind.
You got to stay ahead of the curve.
You got to be the one setting the course for your agency.
So how do you do that?
Well, Michael M. had a bunch of great tips.
Like what?
First of all, you got to read industry journals and blogs.
The classics.
Attend conferences, network with other leaders.
Yeah, those are important.
But he also said, don't underestimate the power of social media.
Oh, yeah. Social media.
And online news sources.
So it's about having a well-rounded approach.
Exactly.
And M actually mentioned a really interesting study.
Oh, yeah. What was that?
It was from the International Executive Development Programs. They followed CEOs of some of the biggest healthcare organizations in the UK.
For how long?
For 2 years.
Wow, that's a long time.
Yeah. And their main finding was that staying informed wasn't just a nice to have. It was a crucial factor in determining whether those organizations succeeded or failed.
So it's not just about knowing what's going on. It's about using that knowledge to make strategic decisions.
Exactly.
And the IEDP actually created a really helpful framework for staying informed.
Oh, yeah. Tell me about that.
They broke it down into 3 main components.
Okay.
The first one is cultivating strategic relationships.
So that's both inside your agency?
Yeah, with your team, your mentors, your advisors,
Okay.
and also outside your agency.
So networking with other leaders in the industry.
Yeah, going to conferences, joining professional organizations, things like that.
Okay, so build those connections.
Exactly.
What's the second component?
The second component is establishing routine practices.
Like what kind of practices?
Well, for example, having regular one-on-one meetings with your direct reports.
Yeah, that's a good one.
And also doing what they call walkabouts.
Walkabouts.
Yeah, like actually getting out of your office and talking to people on the ground.
Oh, I like that. Getting out of the ivory tower.
Exactly.
Okay, so connect with your people.
Yes.
What's the third piece of the framework?
The third component is utilizing the tools of the trade.
Tools of the trade.
Yeah, so this could be anything from data dashboards.
Oh, yeah.
Those are helpful that give you a quick snapshot of your agency's performance.
Okay.
To industry blogs and social media platforms.
Where you can see what people are talking about.
Yeah, it's about using all the resources available to you.
To stay in the know.
To stay ahead of the game.
I like it.
Okay, so we've talked about time management, communication, staying informed.
And now for the grand finale.
The fourth and final daily habit of successful home care CEOs.
Drum roll, please.
Pay attention to details.
Now, that might sound obvious.
It might.
But it's actually really crucial.
Yeah, and Michael M. highlighted this by quoting Keith Myers, the CEO of LHC Group.
LHC Group, they're a big player in home health, right?
Huge.
Yeah.
So what did he say?
Well, during an earnings call, Myers said, the secret is in the details.
The secret is in the detail.
And he attributed a lot of their success to their disciplined attention to detail. So it's not just about the big picture stuff.
Yeah.
It's about sweating the small stuff, too.
And M broke down what this actually looks like in practice.
Okay, how do you actually pay attention to details?
Well, first of all, it's about being meticulous in your own work.
Okay, so dotting your I's and crossing your...
Exactly.
What else?
It's also about showing genuine concern for every aspect of the agency's operations.
Even the little things.
Even the things that might seem insignificant.
Because sometimes those little things can have a big impact.
They can, and it's also about remembering the specifics of conversations.
Especially when you're dealing with employee concerns.
Yeah, because people want to feel heard and understood.
Absolutely.
And then, of course, there's record keeping.
Oh, yeah, that's a big one.
M actually gave a little shout out to the agencies that are still using paper records.
Oh, bless their hearts.
Yeah, maybe that's a topic for another deep dive.
Maybe.
But the point is, whether you're using fancy home health software,
Or just a simple notepad.
you got to have a system for managing the details.
Organized chaos is still chaos.
Exactly.
So any other practical tips from Mr. M?
Oh, yeah, he shared one that he uses personally.
Oh, I'm intrigued. Tell me.
He said he writes down the top 3 things he needs to accomplish each day.
The top 3 things.
Or each week, depending on the task.
And that helps him stay focused.
It does.
Because it's so easy to get sidetracked.
It is.
With all the things that are constantly coming at you.
Okay, so let's do a quick recap.
Yeah, let's summarize what we've learned.
The 4 essential daily habits of successful home care CEOs.
Number 1.
Time management, prioritize what matters most.
And remember, your people are your most valuable asset.
Number 2.
Communicate early and often use all the tools at your disposal to stay connected.
Number 3.
Stay informed on what's trending. Keep your finger on the pulse of the industry.
And number 4.
Pay attention to details because sometimes the smallest things make the biggest difference.
Master these 4 habits,
Yeah.
and you'll be well on your way to leading a thriving home health agency.
You'll be unstoppable.
So as you think about these 4 areas,
Yeah.
I want you to ask yourself a question.
Okay, what's the question?
Which of these habits is the biggest challenge for you right now?
Ooh, that's a good one.
And what's one small step you can take tomorrow to start improving in that area?
I like that it's about taking action.
Because even small changes can make a big difference over time.
Absolutely.
And also think about how these daily habits connect to the bigger picture.
Yeah, like your agency's long-term vision.
Because it's all connected, right?
It is.
And speaking of connections,
Oh, a smooth transition.
this deep dive was brought to you by our friends at Alora Healthcare Systems.
They're a leading provider of home health software solutions.
Their platform is designed to help CEOs, executive teams, and caregivers manage all the complexities of home care.
All those moving parts.
From referrals and patient care to productivity finances, personnel and compliance.
They've got it all.
So if you're looking for a technology partner to help you streamline your agency and implement these best practices, head over to alorahealth.com or give them a call at 1-800-954-8250 for a free software assessment.
They can help you take your agency to the next level.
And that's a wrap for this deep dive.
Until next time.
We'll be back soon with more insights and advice to help you navigate the ever-changing world of home healthcare.
Stay tuned.
And until then, keep leading with purpose and don't forget to pay attention to those details.
Those details are important.
They are.
Okay, signing off.
See you later.